I hope you're having a great day. Today I want to talk about joint pain. This is a problem that plagues millions of people across the world. It's the young, it's the elderly, it's the middle-aged, it doesn't matter. But we need to understand that joints are tissues that connect the bones together. Now these can start degenerating or they could be constantly inflamed, and that leads to pain. And usually we reach out to painkillers to solve most of our joint problems. Now while you may have to take painkillers to basically take care of the pain, we need to understand that it is only treating the symptom. And at some point, we need to get to the root cause of why we have joint pain in the first place. So understanding that lifestyle plays a huge role in the pain that we have in our body, whether it's inflammation, whether it's degeneration, sometimes people involved in accidents or sports injuries, that's a different kind of a pain. We know what the root cause is, and that has a separate way of being treated. But for most of us who start developing joint pain, we need to understand that our lifestyle plays a major role. Number one, there could be inflammation in these tissues. And inflammation is good for us to a particular point. It's the body's way of healing itself. But inflammation should go up, do its job, and then come back down again. Chronic inflammation is what causes issues. There are a lot of inflammatory diseases out there. One is diabetes, cancer, cardiovascular. These are all cases where inflammation goes up and it stays up chronically high, and it upsets all the other working in the human body. So when it comes to inflammation and joint pain today, whether it's knee pain, it's pain in your back, it's pain in your finger joints, it's pain in your ankles. Some people like to blame it on old age, which it may be. And when younger people in the younger generations get this, we have to find out that the root cause could be several of the factors that we're going to talk about right now. Running for a knee replacement may be necessary in a very few number of cases. Other than that, we know it's become a raging business where people with knee pain are immediately told to have knee replacements, and then they have another good life for maybe 2-3 years, and then they start having problems and complications with their knee replacements. Now, I'm not against knee replacements. Absolutely not. I'm for knee replacements when it's really required, or when the patient who's undergoing the knee replacement also knows that they need to change their behavior and their lifestyle. Because no amount of changing your kneecaps or no amount of doing knee replacements is going to solve your problem if you don't change the root cause and your lifestyle of why your joints keep degenerating or getting inflamed most of the time. So we look at acidity. Acidity is a huge problem for us. Acidity leaches calcium from your bones. As our bones get weaker, we have innumerable problems with the cartilage, with the joints, with the tissues, the muscles in the surrounding area. And the more acidic we are, we need to understand that your blood needs to maintain its pH level. So it starts leaching calcium from your bones to make it alkaline and to maintain the alkaline levels of your blood, because your lifestyle is completely acidic in nature. So now if you're leaching calcium out of your bones, you also have low vitamin D3 levels automatically. Almost 1 in 2 people that we see every single day across India have low levels of vitamin D3. You need the right amount of calcium in your bones to maintain your D3 absorption in your bones as well. So we need to understand the root cause is leaching because you have an acidic body. No amount of taking calcium supplements and D3 supplements is going to solve your problem. It may just take care of the deficiency for a while, but you find that your levels come down. And overdoing it on calcium isn't good for your kidneys in the long run either. So if you have an acidic body, if you're constantly acidic, you have indigestion, you have bloating, you have acid reflux, constant migraines, issues with your bowels, which means constipation or IBS, you know that you need to work on your gut, because you know that your system is acidic and you are weakening your bones and joints over time. Second, exercise. We're either doing too little of it. We have sedentary lifestyles. What we don't use, we lose. Whether it's your muscle, whether it's your joint, whether it's your brain, what we don't use, we eventually lose. We become too sedentary. We're constantly sitting. Sitting is one of the worst positions for the human body. We were never designed to sit. If we were designed to sit, it was usually on the ground in a cross-legged position, but not with the kind of comfort that we have today. You see, comfort's become great for us, but it's also caused a lot of discomfort. So we need to understand that having a sedentary lifestyle is detrimental to our joints and our bone health as well. So we want to be active. So there are either people doing very little, or there are people who are overtraining. Now we need to understand that our joints have wear and tear. So the more you use them intensely, so I'm talking about people who over-exercise without recovering, without resting, because all the healing happens while you rest and while you recover. So if you're overtraining and not sleeping enough or not putting enough of investment in your recovery, you're going to have a huge problem with your joints. Secondly is your nutrition talking to your exercise. Yes, there are people who can over-exercise and overtrain. These are called athletes, and they eat according to the intensity of their workout. So if they're training very, very hard, their nutrition supports the amount of training they do. But today, a lot of people try to create a deficit by overtraining, punishing their bodies with exercise and undereating, thinking they'll create a deficit and lose weight. You'll definitely lose weight, and you will also lose a lot more of your health, whether it's your muscles, whether it's your joints, whether it's your immunity, and all of these things. So when you're training, if you want to train like an athlete, you eat like an athlete and you rest like an athlete. Athletes do three things. They eat, sleep, and train. Repeat: eat, sleep, and train. Most of us don't live our lives like athletes because we have jobs to do, we have responsibilities, families, and all of that stuff. So if you're training hard, you better make sure that you're sleeping well and recovering well, because you want to look after your joints before your joints start getting chronically inflamed and they start degenerating again. So sleep and recovery. Third, posture. If you have the right posture, you basically allow even distribution of your weight and your muscles, your joints, your tissues, your ligaments, your cartilage. When we have the wrong posture, we're constantly sitting with the wrong posture, we're standing with the wrong posture, we're walking with the wrong posture. On some joints, some tissues, we put the wrong amount of pressure and burden, and over time that can create inflammation and as well as degeneration of our joints. So we want to make sure that we have great posture all of the time. Do things like Pilates, things like yoga. Just being aware of your posture or having someone remind you every time your posture slips is a good way of maintaining awareness around your posture. Now, very important is autoimmune. There are millions of people who have joint pains like arthritis. Some people have things called Hashimoto's. Some people have lupus. Some people have MS. Some people have eczema and psoriasis. These are all autoimmune disorders, and you need to understand that if you have autoimmune, it is a possibility that your immune system is attacking your joints, and your pain is because of your immune system attacking your joints. Now, can this be reversed? Absolutely yes, in most cases. We need to understand the connection of your gut with autoimmune. In most cases, people have a leaky gut or an inflamed gut, and certain antibodies which are supposed to exit your body now enter your bloodstream through your gut because you have a leaky gut or you have an inflamed gut. These antibodies are not meant to be in your blood. They're meant to exit your body. They enter your blood and it's not supposed to be there, so your immune system sees it as a foreign invader. It flares up, autoimmune, and it starts attacking you. Now, some of these molecules, it's called molecular mimicry. Some of these molecules resemble your thyroid gland, some of them your skin, some of them your joints. So your immune system could be attacking your thyroid gland. For those people, it's Hashimoto's. I can't tell you how many thousands of people over there are out there right now thinking and being treated for a thyroid problem. But unless they do their anti-TPO test and their TG test, they'll never know if they're being treated the right way, because most of them have Hashimoto's, which means their solution and treatment should be in the gut, because their immune system is attacking their thyroid gland. So you heal the gut, there's a possibility to bring down your TPO count, reduce the antibodies in your blood, which means your immune system starts settling down and you can actually heal. For the other people who have arthritis and are told to believe that they have to live with this pain throughout their life and take constant pain medication, no. In most cases, again, you have antibodies in your blood. And if you heal your gut and you stop the leakage of those antibodies in your blood, you can stop the immune system, in most cases, from attacking you. And we see constant reversals all the time. So if you have arthritis and all these joint pains, it is necessary for you to check your TPO count and your TG count. Now, let's get straight into solutions. Okay, definitely if you have joint pain through injuries or, through different triggers that you're unaware of, sometimes physio and the right amount of exercise, which is designed for that joint to move in a particular way, will definitely help you. So you want to get someone who can understand your injury or understand your pain and do the right amount of physio with you. Learn those exercises, you can do it on your own. When it comes to food, there are two inflammatory foods, which are milk, basically dairy, and gluten. So if you suddenly start suffering from joint pain, you want to start getting off wheat and dairy completely and see if there's an improvement. Because these two inflammatory foods basically inflame your gut. And sometimes because you have an inflamed gut, we just explain what happens with the antibodies. So sometimes just by getting off gluten and dairy, you may just solve your problem. And sometimes that's not the solution, so then you can go on eating it if it's not affecting you. Turmeric. Anti-inflammatory, highly anti-inflammatory. Most of your joint medications around the world, most of your joint supplements contain things like turmeric, ginger, boswellia. All of these are fantastic spices and herbs that help you reduce inflammation because it's anti-inflammatory. The pain that you're feeling is basically inflammation. Using a hot or cold pack, according to your professional advice, can also help you to reduce the joint pain that you have. Now, you can use sesame oil, you can use coconut oil, you can use a combination of olive oil and sesame oil on the areas which are inflamed to basically reduce the amount of pain. But remember, usually joint pain is an inside out if it's not caused by any physical injuries. So you can use oil treatments to basically reduce the pain, but you still got to look inside your system, look at your digestion, look at your microbiome, look at the symptoms that your body's telling you, which may be giving you a clue that your gut health is bad, and repair that. If you carry a lot of weight and you have joint pain, of course, losing a little bit of weight in a safe way will take that weight and that burden off your joints. Remember, your joints have to carry the weight of your entire body. So losing even a little bit of body fat, a little bit of weight will take that pressure off your joints. Collagen as well is fantastic for repairing these tissues. So there are food sources, there are supplements which are rich in collagen. Basically, most of the non-vegetarian sources have a lot of collagen. If you're vegetarian, you can take supplements with collagen, but it plays a huge role in healing your joints. Other than that, the most famous foods that will help you are your fruits, your vegetables, your omega-3s. Whether you get it in a non-vegetarian source like fish oil, or you get it in flaxseed oil, or walnuts, or things like almonds, pumpkin seeds, all of your nuts and seeds are great fats for your joints. Over and above that, you have the kind of oil that you use to cook at home. Refined oils create inflammation in your body. It will make your joint pain worse. So you want to make sure that you're using cold pressed oils, you're using things like PO ghee, whatever oil you use, you want to make sure it's not refined so it can reduce inflammation in your body. We need good fats for the health of our joints. We need good fats for the health of our tissues as well. You have something called bromelain. Bromelain is found in pineapple. It's an enzyme which is highly anti-inflammatory. So eating pineapple, using a bromelain supplement, whatever your choice is, bromelain plays a huge role in reducing inflammation in your joints and reducing your pain. And finally, looking at your calcium and vitamin D3 levels, because if you have a lack of calcium, you have a lack of vitamin D3. And if you have a lack of vitamin D3, most of our bone pain and most of our joint pain is caused because of that. So really, you need to introspect into your lifestyle and see what could be causing my joint pain. Okay, you need a painkiller, take it, but that's not going to sort your problem. That's only going to treat your symptom, and after a while, your painkiller is going to affect your kidney and your liver. So you want to see what lifestyle changes you can make in terms of your diet, in terms of your exercise, your sleep and recovery, and of course your stress levels as well, because we all know that stress has a huge impact on every single cell and tissue in the human body. Have a great day, everyone. Until next time, eat smart, move more, sleep right, and breathe deep.